we will describe the skeleton of the human body, its component, and its function. The function of the skeleton of the human body is to provide the body its framework, to allow movement, to protect the vital organs, as the skull protects the brain, the vertebral column protects the spinal cord, the thoracic cage protects the lung and the heart. Then it forms blood cells, acts as a reservoir for calcium and phosphorus. Some claim that it has an endocrine function. The skeleton of the human body forms the framework of the body, protects the vital organ, allow movement, forms blood cells, acts as a reservoir for calcium and phosphorus. For purpose of description, it is classified into axial skeleton, which lies nearly in the midline, and the appendicular skeleton, which forms the skeleton of the limbs, either that of the upper limb or of the lower limb. The axial skeleton is formed from first, the axial skeleton formed from the skull, first, vertebral column, and the thoracic cage. These are the components of the axial skeleton. This is the skull, and the vertebral column, you will see it. This is the vertebral column, and this is the thoracic cage. The skull formed from many bones. The only articular joint or only synovial joint, movable joint, is the temporomandibular joint. Otherwise, the skull formed from several bones united together by fibrous joints called sutures, and these joints doesn't allow movement except slight movement at base, which allow to decrease the size of the skull. The skull forms the bones of the facial skeleton, and it protects the brain. The mandible allow speech, mastication, and of course it shares the skull in the formation of the facial skeleton. The vertebral column is formed from 33 vertebrae, classified into cervical vertebra. The cervical vertebrae are 7 in number, 7. Then the thoracic vertebra, 12 vertebra. Then the lumbar vertebra, 5. Sacral vertebra, 5. and the coccygeal vertebra from 3 to 4. This is the vertebral column formed from 33 vertebrae, 7 cervical. They are named according to the regions where they are present. 12 thoracic in the thoracic region, 7 cervical in the neck region, 12 thoracic, 5 lumbar in the lumbar region, 5 sacral, and coccygeal. Coccygeal are rudimentary in males. In humans, they will develop in animals to form the tail. Then the thoracic cage is formed from first anterior view. This is thoracic cage formed from the sternum in the midline, sternum in the anterior midline, and 12 pairs of ribs, 12 pairs of ribs articulating behind with the thoracic vertebrae. The thoracic cage formed from the sternum. This is the sternum, and 12 ribs on both sides, and a thoracic vertebrae. This is the anterior view of the thoracic cage. If we look to the posterior view of the thoracic cage, we will find here the scapula lies on the back of the ribs. This is the scapula, forms the posterior bone of the pectoral girdle, which ties the upper limb with the trunk. This is the thoracic spines, and this is the ribs. This is the posterior view of the thoracic cage, formed, as we said before, from the sternum and the midline. This is the sternum. This is the sternum, and the ribs. 12 pairs of ribs on each side. This is the scapula. If we look to the thoracic cage from behind, we will find the scapula lies, not articulating, lies on the back of the ribs, and these are the thoracic spines. The thoracic cage protects the heart and lung. This is the axial skeleton formed from the skull, the vertebral column, and the thoracic cage. The thoracic cage anterior view, and this is the thoracic cage posterior view. This is the axial skeleton. What about the appendicular skeleton? The appendicular skeleton is formed from bones of the upper limb. This is the bones of the upper limb, and the bones of the lower limb. The bones of the upper limb formed from pectoral girdle, formed from the clavicle and the scapula. Pectoral girdle formed from the clavicle and the scapula, articulating or tying the upper limb. Here's the humerus, here's the humerus, articulating with the scapula. This is the clavicle. The pectoral girdle ties the upper limb with the trunk. This is the bones of the upper limb. This is the bones of the upper limb. Here, This is the clavicle. This is the scapula, forming the bones of the pectoral girdle. This is the humerus. The humerus forms the bone of the arm. This is the radius and the ulna. Radius and the ulna. This is the radius, the lateral bone of forearm, and this is the ulna, the medial bone of forearm. This is the humerus, articulating with the radius and the ulna at the elbow joint. This is the elbow joint. This is the radius forms the lateral bone of the forearm, and this is the ulna forms the medial bone of forearm, articulating with the carpal bones here at the wrist joint. This is the wrist joint, and these are the bones of the hand. Bones of the hand. Returning back, this is the bones of the upper limb, formed from first pectoral girdle. This is the pectoral girdle, clavicle and the scapula. This is the humerus, bone of the arm. This is the radius and the ulna. Radius and ulna, which forms the bone of the forearm, and these are the bones of the hand. Okay. What about the bones of the hand? The bones of the hand, here, this is the lower end of the ulna. This is the lower end of the radius, articulating. These are the carpal bones. These are the carpal bones, articulating them with the radius and the ulna at the wrist joint. These are the metacarpal bones, counted from the big or the thumb, the big finger, the thumb. This is the first, second, third, fourth, and the fifth. These are the phalanges. The thumb has two phalanges only. The thumb has two phalanges only, proximal and distal. These are the second metacarpal bone, third, fourth, fifth. These are the proximal phalanx of the index, middle, and distal, where here are the phalanges of the other four fingers. These are the bones of the upper limb. What about the bones of the lower limb? The bones of the lower limb are, first, the pelvic girdle. The pelvic girdle formed from one bone only. This is the hip, called the hip bone, or pelvic bone, or a mnemonic bone. This is the hip bone, here, hip bone, or a mnemonic bone, articulating with the sacrum. This is the sacrum here. This is the sacrum. Here is the sacrum, which lies at the lower part of the vertebral column. This is the sacrum, collecting a lower limb with the trunk. This is the sacrum, articulating with the hip bone here at the sacroiliac joint. This is the hip bone, articulating with the femur at the hip joint. This is the hip joint. Then the bones of the lower limb is formed from the hip bone, forming the pelvic girdle, articulating at one side with the sacrum to transmit the weight of the body to the lower limb, and articulating with the femur at the hip joint. This is the femur, which is the bone of the thigh. This is the femur, which is the bone of the thigh. And here is the knee joint. This is the knee joint. This is the patella or kneecap, which is a sigmoid bone. This is the femur, which forms the bone of the thigh, and this is the patella, sigmoid bone, to protect the tendon of the quadriceps femoris muscle. And these are the bones of the leg, the tibia medially and the fibula laterally forming the bones of the leg. And these are the articulation between the tibia and the fibula and the tarsal bone to form an ankle joint. This is the ankle joint. This is the ankle joint. This is the tibia, which forms the medial bone of the leg, and the fibula forms the lateral bone of the leg, articulating with the tarsal bone at the ankle joint. This is the ankle joint. This is the ankle joint. And these are the bones of the foot. With regard to the bones of the foot, we will see first, these are the bones of the foot. Here is the calcaneus. This is the calcaneus, and this is the talus, which articulate it, the lower end of the tibia articulate here to form the ankle joint, and here for the lateral malleolus with the fibula, and here articular surface for the medial malleolus of the tibia to grip the ankle joint, as the weight of the body is transmitted one half to each side. And sometimes if the person elevates one leg from the ground, the whole body weight is transmitted to one side. Here the body weight lies transmitted here. So this is the articular surface with the tibia, and these are two articular surfaces to grab on the talus to prevent sliding. These are the tarsal bones. This is the navicular, cuboid, cuneiform, and these are the metatarsal bones. As a rule, we count from the big toe in the foot or the thumb in the hand, which is the great finger. Here, this is the first metatarsal bone. This is the second metatarsal bone, third, fourth, and fifth. Also, as a rule, the great or the big toe has two phalanges only, and the big finger, if it is considered as a nomenclature, has two phalanges only. Here the big toe has proximal phalanx and the distal phalanx. The other four toes here in the foot has proximal, middle, and the distal phalanges. But this is the skeleton of the human body. A skeleton of the human body formed from several bones. These bones are 206 bones in the adult. However, in the newly born are more than this number, as some bones will fuse before puberty. The axial skeleton of the human body provides its framework, allow movement, protects the vital organs, forms blood cells, stores calcium and phosphorus. It is formed from forming the axial skeleton, and the appendicular. The axial skeleton is formed from the skull, the vertebral column, which is formed from 33 vertebrae, and the thoracic cage, which is formed from the sternum, and the ribs, 12 pairs on each side, 12 ribs on each side, and 12 pairs. And the thoracic vertebra behind. The bones of the upper limb, then this is the axial skeleton, the appendicular skeleton divided in the bones of the upper limb and the bones of the lower limb. Bones of the upper limb has pectoral girdle. This is the pectoral girdle formed from two bones to allow free movement. However, in the lower limb, the pelvic girdle is formed from one bone only to allow stability, or to give stability. One bone only, the hip bone, or the pelvic girdle, or pneumatic bone, and finally the bones of the hand and bones of the foot. This is the anatomy of the skeleton of a human body. I hope that it will be beneficial for our dear students at their beginning in the studying medicine, dentistry, nursing, pharmacy, sports medicine, and physical therapy. Thank you.